Come on. Let's talk about sex, baby. Let's talk about you and me. Let's talk about all the good things that make me. Let's talk about sex. Let's talk about sex. Let's talk about sex.
All right. So we talk about sex education and how it can save lives, particularly contraceptives. All right. So who am I? My name is Nakia. I go by Kia. I am a SHES, which is a certified health education specialist. So my background is in health promotion. I got my bachelor's in health promotion from Indiana University in May 2020. I couldn't walk across the stage because of COVID-19, of course, but the pandemic has played a huge role in my career. So, before bachelor's, I got my associate's in general studies from Ivy Tech in 2018. I am currently pursuing my master's in public health from Indiana State, and I want to do epidemiology with that. I'm kind of doing that now. I've been working. My work has been related to COVID-19 since I graduated from college. So I've been working in public health field officially a year now. I relocated out of that small town, and I make more money, and I love what I do. And I became a certified health education specialist in October 2020. And I currently work for the CDC Foundation in collaboration with the Indiana Department of Health as a communicable disease investigator or a public health investigator for COVID-19. I'm going to talk a little bit more in another video about health promotion versus health education. But yeah, that's who I am, and that's my background. So what is sex education, and why is it so taboo even in 2021? So, quality sexual health education provides students with the knowledge and skills to help them be healthy and avoid human immunodeficiency virus, HIV, sexually transmitted diseases, STD, and unattended pregnancies, according to the CDC in 2020. World Health Organization in 2016 said that sexual health is the integration of somatic, emotional, intellectual, and social aspect of sexual being in ways that are positively enriching and that enhances personality, communication, and love. Fundamental to this concepts are the right to sexual information and the right to pleasure. I like the World Health Organization definition better than the CDC one. Of course, I think the World Health Organization one is more for those that are more experienced. I feel like that is more for like, I don't know, like that's more experience. And then I think the CDC is more like education, protect, prevent, this what you do. World Health Organization is more like sexual being, it is more like emotional. Yes. So that is sex education according to two great organizations. So sexual liberation. I'm going to go on this timeline real quick. We're going to talk more about this timeline in a few slides. So March 2nd, 1873, Congress passes the Comstock Law, an anti-obscenity act that specifically lists contraceptives as obscene material and outlaws the dissemination of them via postal service or interstate commerce. Basically, this law said they cannot send or receive contraceptives. They cannot make contraceptives at all. That's in 1873. 7 years later, in 1880, the cervical cap was invented. All right. So Margaret Sanger's coins. She helped with the term, quote, birth control and dared to use the phrase in June 1914. think about it, people. That was a little bit more than 100 years ago. The first term birth control was first used in the issue of the Woman Rebel magazine. For this crime and others, Singer is indicted for 9 violations of the Cornstalk Law. Imagine going to jail because you said birth control in the magazine. Okay? 1918, therapeutic birth control is legal. 1920, women can vote. Again, 100 years ago, we could not vote. Females, please vote. In 1968, not even 100 years ago, Reader's Digest article, Everyone Knows What the Pill Is. It is a small object, yet it is potentially effective upon our society. Many be even more devastating than a nuclear bomb. What? Come here, Lily. And then there was sex. This is a female genitals, as you can see. You have use my pointer. You have the anus, the perineum, which connects the anus to the vagina opening, the labia, which is the inner lips, and this is the outer lips, also the labia, the clitoris, right here, the opening of the bladder, the urethra, right between the clitoris and the opening of the vagina. So now you see the female reproductive system in the side glands, which is transverse. You got the rectum right here, the vagina. Of course, no, in the vagina, if you're having sex with a male, penis goes in the vagina, and that is her cervix. Like that little bump you feel is the cervix, and the baby. Like once you have sex and ejaculates and you're ovulating, the baby grows this is the uterus. So this is the cervix and this is the uterus. The baby grows in the actual uterus. Again, like I said, the clitoris would be like right here, and this is the vagina opening, and this is the urethra, your bladder right here. You get urine out. Your fallopian tube, one right here, one on the other side, and then it has the ovaries right there, fallopian tube, ovaries, again, uterus. This is the male reproductive system. You have the rectum, the prostate gland right here, the seminal vesicle right here, tube, ball sac when they're ejaculating, sperm cells, all that good stuff comes out through the urethra and into whatever or onto whatever. They also, of course, pee out this hole, so they urine out this hole, and their sperm come out that hole. This is their testicles. This is the actual penis. That is the bladder. Again, it's either coming from here or coming from the bladder. This is the ductus deferens. So that is the male reproductive system. Oh, I'm sorry, and the epididymis. Gosh, I can't talk. The epididymis. So we're going to talk about non-hormonal birth control methods. So the male condom, of course, worn by a male man to prevent sperm from entering the body. Male condoms can help prevent pregnancy, STDs, STIs, HIV, and has a failure rate of 13%. This can only be used once. So think about it. So that failure rate is out of 100. So 87% of the time, the condoms are going to protect you from all of these things, but 13% of the time it's going to fail. So out of 100 times, 13 times, basically. Female condoms, of course, worn by female. The female condom prevents sperm from entering the body. Failure rate is 21%. Again, you have that 79% chance that you're going to be protected, and then a 21% chance that it's going to fail. Female condoms protect you from pregnancy, STDs, STI, and HIV. And I don't know if anyone's ever seen the female condom, but to put it bluntly, it's basically like a bag, kind of a big long condom. You put it over the vagina, and that protects the female. I think male condoms are more popular than female condoms in some cultures. All right, so the diaphragm, also called the cervical cap, is a barrier method placed inside the vagina to cover the cervix and block the sperm. Before intercourse, the cap is to be inserted inside the vagina. A doctor visit is required to get the proper fitting because a lot of people, I think everyone has different cervix sizes in some instance. If you have never had kids, your cervix will be different than someone who's had a kid or several children. Of course, failure rate is 17%, so that means 17 out of 100 times that you do the diaphragm, it's gonna fail 17% of the time. But it's also going to have a success rate of 83%. So spermicide. These products work by killing sperm in several forms. There's foam, gel, cream, film, a suppository, and a tablet. These are placed also inside the vagina no more than 1 hour before intercourse. You can leave them in 6 to 8 hours after intercourse. Failure rate is 21%, which basically means, again, 21 out of 100 times it's going to fail, but 79 times it's going to have a success rate. Do keep in mind that sperm can live inside the vagina for 5 days. So when you are using like a cervical cap and you take it out and there's still sperm inside your vagina, that sperm can travel into your cervix and possibly you could become pregnant. It's best to use a diaphragm and spermicide together to help prevent that. You also have the fertility awareness method, which can prevent or plan a pregnancy. Your monthly cycle is going to be tracked using this method. So we're going to track the days you are fertile. As you can see in the chart, these are the fertile days that the patient have. So we're going to start with day 1. So day 1 is the first day of your period. Say you bleed for 3 days, then you're going to start with day 4. Day 4 will start turning blue as your fertile day. If you bleed for 5 days, you're going to start at day 6. If you bleed for 7, of course, you're going to start at day 8, so on and so forth. So the fertility awareness method really tracks, again, when you are fertile and when you're infertile. So using fertility method, which I know some people really don't believe in, and some people swear by it, you're going to avoid having sex on the days you are fertile. Like if these are your fertile days, you're going to avoid having sex on these days and have sex on these days. Of course, your fertile days normally aren't this long. Like it's normally like 5 or 7 days of like your high fertility. And then like the days after you're like unfertile or like low pregnancy, so there's a low chance you'll get pregnant, so people have sex on those days. Do keep in mind the body is very unique and complicated. So I mean, you can think you're like, oh, I'm gonna ovulate on day 13. Don't have sex, of course, leading up, because again, remember, sperm can live inside the vagina for up to 5 days. So say I am fertile on day 13th, like I will ovulate that day, so I don't have sex between these days. But what if your fertility is 2 days delayed or 1 day delayed? You know, like those days matter when you start again having sex. Um, so the fertility rate varies across, the failure rate varies across these methods. Typical failure rate is 2 to 23%. Again, you have that 23% because your body can ovulate late. If you're not tracking your cycles, or your cycles are unregular, you have to have a regular cycle to track these. If you're unregular and one day you're 23 days, your total cycle is 23 days, one day is 29 days, like you cannot really predict when you will ovulate in order to avoid pregnancy. If you don't ovulate, of course you cannot get pregnant because there's no egg to impregnate. Um, yeah, and of course, like 2%, this is someone who's really, their cycle's really regular. They know when they ovulate like clockwork, and they know when to avoid. Like they know. Plus, your body also gives you signs like when you're ovulating. Like some people have like um, one-sided pain from that egg getting released from that fallopian, from that ovary. I'm sorry, travel down the fallopian too. Some people have that pain. Some people have that egg white discharge. So you can really know your body and know when you're ovulating to avoid pregnancy, or even know when you're fertile to avoid pregnancy. Or if you like, use birth control. There's so many non-hormonal barrier methods, and there's also hormonal barrier methods. Whatever is best for you. Hormonal birth control. All right. Let's talk about the implant. So the implant is a thin rod inserted in underneath the upper arm. The implant contains progestin that is released over a 3-year period. Typical failure rate with the implant is 0.1%. That means 99.9% of the chance it's going to protect you. Like, it's very uncommon to get pregnant using an implant. The injection or the shot, did that fail? Ask a lot of people. Most common name. Women get a shot of the hormone progestin in their buttocks or their arm. This happens every 3 months from a medical professional. So again, you will have to go to the doctor. Sometimes you can go to the pharmacist to get this procedure. Typical failure rate is 4%. That means out of 100, 4 times it's gonna fail, but 96% of the time it will not. I also have birth control pills. They have the oral contraception, combined oral contraception method. The pill is a combined oral contraceptive that contains estrogen and progestin. It is prescribed by a doctor. A pill is taken at the same time each day. If you're older than 35 years old and smoke, have history of blood clots or breast cancer, your doctor may advise you not to take the pill because of complications that may arise. Typical failure rate with the birth control combined method pill is 7%. Again, 7 out of 100 times it's going to fail, but 93% of the time it will not. We also have the progestin method, or the progestin only pill, aka the mini pill. This contraceptive has one hormone, progestin, instead of estrogen and progestin. It is prescribed by a doctor and taken at the same time each day, just like the combined method pill. This may be a good option for women who cannot take estrogen, or for those who are breastfeeding, because you cannot breastfeed and take estrogen. Typical failure rate for this pill is 7%, just like the combined oral method. Again, 93% of the time it will not fail, but 7% of the time, it might fail. They also have the patch, which is this little, I guess you like more adhesive than a sticker, but you stick it on you, take a shower, it's waterproof, it will not come out if you take a shower. So the skin patch is worn on your lower stomach, your butt, or your upper body, not the breast, the arms maybe. This method is prescribed by a doctor. It's normally given in doses of 3, so you get 3 patches, and you come back for the other 3 patches. Or you can get 3 months supply, so you get 9 patches total, and then after 3 months, you come back for the additional patches. You wear it for a week, and you take it off once your period comes. So you wear it for a week. So say I start on Friday. I wear it Friday. The next Friday, I put a new patch, take off the old one. Again, do the same thing the week after that. On the 4th week, I don't put on any patches. My period comes Friday. Once that my period comes, so like on Monday, Friday again, I put that new patch on. Typical failure rate with this is 7%. Again, just like those pills, 7 times out of 100, it's gonna fail on you. But 93% of the time, it will not. The ring is also a birth control method. The ring is inserted inside the vagina. It contains hormones, progesterone, and estrogen. You wear the ring for 3 weeks, take it out for the week you have your period, then put in a new ring. Typical failure rate again is at 7%, just like the patch and no pills. And this is the ring. Most times it'd be the Nuva ring. I've always heard about that as a kid, and that's what you like, a little small little ring you insert inside your vagina to protect you from pregnancy. And birth control does not protect you from STDs, STIs, or HIV. It just protects you most times, depending on the birth control, from pregnancy. So we have the IUD. So the IUD is a small. So this is the hormonal one. The LNG IUD is a small T-shaped device like the copper ID or the Mirena. They have one called the Kalini. Anyways, it is placed inside the uterus by a doctor, so you cannot insert this yourself at home. You do not remove this by yourself at home. You can cause issues trying to remove this device without a medical professional, aka a doctor. It releases a small amount of progesterone each day to keep you from getting pregnant. The LNG IUD stays in your uterus for 3 to 6 years, depending on the device. Typical failure rate is 0.1 to 0.4%. That means 99.9 to 99.6 at the time you're going to be protected. That's a really high protection rate. The copper IUD does not contain hormones. Again, it's a small device, just like the LNG ID. This is specific one that we're looking at right here. This is the copper ID. Again, you make a medical appointment. Doctor makes sure you are a good candidate. It's placed inside your uterus again. And then it contains no hormones. And it stays in your uterus for 10 years. So you stay in it more than like the hormonal IUDs, 3 to 6 years. You have 10 years, and they're doing more research to say maybe you can have that stay in longer. But yeah, I read some research paper that the copper is an acidic type A substance, and it prevents this. It's like a spermicide. I guess it works as a spermicide. It prevents the sperm from getting in the fallopian tubes and making a baby. Like, it's very hostile here. So there's no one's gonna implant in a hostile environment. Think about that. Baby's not gonna implant here if it's hostile. Like, this copper ID is making it very unhomely, I guess. Yeah, again, sorry. So 0.8% of the chance it's gonna fail. I don't know if I said that or not. So 99.2% of the chance you're gonna be successful using this method. I'm gonna talk about permanent birth control methods. So Female sterilization, aka tubal ligation, or your tubes getting tied. A woman can have her fallopian tubes tied or closed, so that the sperm and the egg cannot meet for fertilization. So think about it. Remember, this is the vagina. This is the cervix. So the sperm, this is the cervix, and the egg gets released from these tubes, these ovaries. So like that. I guess I could say this is my left ovary, and this is my right ovary. So the eggs can release. This is the sperm. So tying your tubes prevent that egg from joining that sperm. Like it cannot join. It's closed. This is closed. It will not get released. It will not meet each other. This procedure can be done in a hospital or in an outpatient surgical center. Again, this is permanent, meaning you should not want any more kids after this. Like you're done. You're tying your tubes. You can go home the same day for this tying the tube surgery and resume your normal activities within a few days. This method is effective immediately. Immediately. Okay. If you're ovulating, God forbid that egg has not reached that uterus yet, or too far in and that sperm has not met. But say you have had sex and you just started ovulating. Tie your tubes, you're good to go. Typical failure rate is 0.5%, which means, again, 99.5% of the time, you're going to be successful. The male sterilization is called the vasectomy. This operation is done to keep a man's sperm from going to his penis. So again, the ball sack, the sperm, there's still stuff coming out. It's just not, there's no sperm cells in his cum, his fluids, his bodily fluids. So this procedure is typically done at an outpatient surgical center. The man can go home the same day. Recovery time is less than 1 week. After operation, a man visits his doctor or tests to count his sperm and to make sure the sperm count has dropped to 0. This takes 12 weeks. Another form of birth control should be used until the man's sperm has dropped to 0, which means that he might get a vasectomy. He got a vasectomy last week. He still has sperm cells. You have sex with that guy unprotected while you're ovulating or unprotected period, you can get pregnant. You can still get pregnant. Typical failure rate with this is 0.1. Typical failure rate with this is 0.15%, which means 99.85% of the time it will be successful. Emergency contraception. Emergency contraception is not a regular method of birth control. Emergency contraception can be used after no birth control was used during sex, or if the birth control method failed, such as a condom being broke. Or let's say you missed a pill and you had unprotected sex. A plan B, emergency conception, can be taken afterwards. Copper IUDs can act as a plan B if it's inserted within 5 days of unprotected sex. We spoke earlier about that copper ID making it really a hostile environment for implantation of embryos or eggs that has been fertilized. So copper IUDs can work as a plan B if inserted within 5 days of unprotected sex. And again, remember, sperm can live inside of you for 5 days, up to 5 days. Emergency contraceptive pills, aka Plan B, one step. This is the typical box you'll get. Women can take emergency contraceptive pills up to 5 days after unprotected sex, but the sooner the pills are taken, the better they will work. So if you slip up and you have accident, you have unprotected sex, the next day take a plan B, or within 72 hours take a plan B. Again, you can take it up to 5 days after unprotected sex, but the sooner you take it, the better it will work, the better your chances that it will be successful. There are 3 different types of emergency contraceptive pills available in the United States. As of 2021, I believe you do not need a doctor prescription for a Plan B. You can go to your local pharmacy and pick up a Plan B pill. Um, some emergency contraceptive pills are available over the counter. Again, you can go to the pharmacy and get those. You can go to your doctor and get those. So those are emergency contraception. It protects you from getting pregnant after unprotected sex. Again, it's not a birth control method. This happens like, oh my gosh, a condom broke. Plan B. It's a Plan B. It's not birth control. Right. So these are this chart I got from the CDC about, more effective birth controls up here, less effective down here, less effective tier 3, more than 13 pregnancies per 100 women in 1 year. You got male condoms, again, the fertilization awareness method. That's checking your period. You got the diaphragm, you got the sponge, you got the withdrawal method when you pull out before you come, to prevent the sperm from being inside the vagina to prevent pregnancy. The female condom and spermicide, which kills sperm. So this is used every time. So these methods used correctly every time you have sex. 13 pregnancies per 100 women in 1 given year. And we talked about fertility awareness method. Tier 2, 4 to 7 pregnancies per 100 women. Again, it's less than these methods, but you still have 4 to 7 pregnancies per 100 women per year. And these are going to be your shots, your Depo-Veras, your pills, your birth control pills, the patches, the rings. This is to make it more effective, you get your repeat injections on time. Of course, to make it more effective for pills, take the pill each day at the same time. Patch in the ring, you keep it in place and change on time. You don't go over a few days and put it on late. Like, you take it off and you put the next one on, because those hormones are being put into your skin. So after a while, the hormones will be less effective because you need to replace it. Tier 2, more effective, the most effective methods, less than 1 pregnancy per 100 women in 1 year. You have the implant, that's the thing that goes on your arm, the vasectomy for the men, tubal litigation, like tying your tubes for the women. The IUDs, of course, is going to make, those are all more effective than the rest of these methods. And again, to make it more effective, specifically the vasectomy, you want to use another form of birth control for the first 3 months, because it takes a while for your sperm count to reach 0. And if your sperm count has not reached 0, even though you just got a vasectomy and you have unprotected sex, that person can get pregnant. Teen pregnancy. So, social health determinants include a person's age, the environment in which people are born, live, learn, work, play, and worship. This is your environment where you live, your neighborhood, your school, your career, the playground areas, the yards in your environment, if you're religious, the church you go to, what do you believe in? These are all social determinants of health. How old you are, older age versus someone in a younger crowd. People who are between 15 and 24 have the higher cases of new STD and STI rates in the United States versus those that are older. Age determines a factor in your health. Social determinants of health. These determine your health. The health determinants affect a wide range of health issues in the quality of life and outcomes and risk. Certain social determinants of health, such as high unemployment, low education, and low income, have been associated with higher teen births. Why do you think this is so? Why do you think that teens who grew up in an environment with low education, say their mom and dad did not graduate high school, low income, because let's be honest, if you don't have a high school diploma, at minimum, you're not going to get paid that much. You're going to be limited in your job ability. High unemployment rate, because a lot of jobs require that basic high school education. So, they can't find a job because a lot of jobs require high school diploma or college degree, and they don't have that. Low education because they dropped out of high school. Low income because they cannot find a decent paying job that's going to pay them enough to live off of because of their low education. So I think that's associated with higher teen birth, because what are those teens going to do? A lot of times when they're in that high unemployment, low education, and low income environment, they're living in poverty. They're living in environments that are not the safest. Um, there's no parks to go to have fun with your friends. There's no playing safely outside. There's no engaging in healthy behaviors and healthy relationships, and you may not know what they look like. So those teens are not gonna have the best quality of life. There's a limit of what they can do. So they might find that one person, that partner, they can't go to anywhere else, and that partner makes them feel safe. Say when they're stressful at home with being in poverty and poor and like figuring things out with their lives, they're gonna turn to sex, and it's not gonna be not the best practice. Is going to be sex with not using condoms or birth control, because they don't have that education part. Their parents are not telling them, hey, wear a condom, blah blah blah. They're not telling them that. So these kids are going to engage in behaviors like that, and they can be pregnant. Also, some kids come from really rough backgrounds, and there's kids that are in prostitution, child pornography rings. These kids are going to grow up way faster than they're supposed to. And they're going to engage in these high risk behaviors like prostitution. And that's going to lead to unplanned teen births. Those are a few factors and scenarios that can affect the fact that high unemployment, low education, low income have been associated with higher teen birth rates. And if you want to add anything to that, feel free to contact me. Okay. So these are the births for women per 1,000 women ages 15 to 44 years old. These are all races across the board. And these are non-Hispanic races. These are all non-Hispanics. And then these are the Hispanics. So you got 70%, 67%. Then whites, 58%, 57%. Blacks is higher than whites, of course. 63.3, 63.1. I say of course because black people are more likely to be in poverty with low education and high unemployment rates compared to whites. And there's so many factors that is going to affect the fact that that is true. Specifically, systemic racism, long, deep-rooted in America. That is how it is. That played a role in this. And it's probably a lot of years of catching up to do to even get this remotely lower to match the white people, or even our races average. This is Island Pacific Islanders. They're 62 to 59.5%. Asian Americans or Asians is 61, still lower than African Americans, but still higher than whites, 61.1 and 58%. Still higher than whites, but lower than blacks. This one highest, 72.9 and 72.8. I believe these are Native Americans, Hawaiians, and then Hispanics. And Native Americans and Indians have higher than any other race, because they are more likely to be in poverty than anyone else. They really are. You got low poverty rates, you got high drug usage, low education, some communities. That's how it is. So you have that high birth rate compared to any other race or ethnic minority.